Okay, I always start with this when we have a doctor. I love seeing your juices get flowing when you get a doctor on the other side of the conversation. And today we
Yeah.
were lucky enough to have Dr. Kathleen Jordan, who's the Chief Medical Officer of Midi, and we really covered quite a wide range of topics.
Well, that's what happened. I have to say, my favorite thing is how Midi and Dr. Jordan really spoke about the multidisciplinary approach to perimenopausal and menopausal care because nobody really owns this space solely. It is such a collection of different perspectives and disciplines. So I found that so enjoyable.
Amazing. So let's
So
take a
let's take a
listen.
listen. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Sherrill. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have our guest today, Dr. Kathleen Jordan, who's the Chief Medical Officer of Midi, which is the company and specifically the menopause company that's on everybody's lips and in every article and in constant source of discussion as the menopause world explodes. Welcome.
Yeah, thanks for hosting the conversation. I'm looking forward to it.
So I have the biggest question that's literally been burning on my mind because I believe you come from the world of internal medicine and infectious
Mhm.
disease. And I, of course, come from the world of OBGYN. And I would
Mhm.
just love to hear who the heck owns menopause and perimenopause? Do you consider it to be like a village or do you consider it to be part of one particular field? I know this is a hot topic right now.
I think it's actually part of every field of medicine, and I think that's been one of the big misses. So, the hormone changes of perimenopause and menopause impact so many things. It impacts your hair, your skin, your metabolism, your body fat distribution, your cholesterol levels, right? Your cardiovascular disease. So, I think it's been unfair to say that only OB-GYNs have to
Mhm.
know about menopause or should know about menopause. Really, every specialist. And I think it's really been a secret to Midi's growth because we really pulled in a multidisciplinary group. I'm an internist, we have OB-GYNs, but we also have
Yeah.
specialists, skin and hair specialists, right?
Yep.
And bringing in all that expertise is really what we have found best supports women.
I couldn't agree more. So thank you for that validation. I agree wholeheartedly.
Yeah.
In this menopause arms race, if you will, Midi seems to be always at the front of the line. From your perspective, what has Midi done, clinically and from a business perspective, right? And they've done a lot right. You've done a lot right that has sort of positioned you as the one to beat. You have the largest valuation in the space, even though you came out of the gate as a menopause company. Obviously, it's a much more expanded scope of services right now. What are the things that really differentiate you and that are really driving the most important thing, which is consumers slash patients signing up to get care and products and feeling better and coming back?
What? Well, I'm going to say I don't actually look at it as an arms race. We currently have like 5% of women in eligible age ranges accessing hormone therapy. And I don't think clinically that it should be 100%, but I do know that it should be way more than 5%.
Yeah.
So we need MIDI and we need 10 other MIDIs as well, right? So there's that, and so we collaborate a lot with care products, new care solutions, all sorts of companies to really better health for women. Um, but I think layered in there is your question is sort of what's been Midi's success and why have we been leading? I think because our care is great, actually. And I think we also take a broader view that Dr. Dweck referred to before, in that menopause is kind of it's a phase of life, and many aspects in that woman's health and life journey are impacted by the hormone changes in menopause. So we don't narrowly define menopause care as being a hormone therapy prescribing company. We look
Right.
at it as, hey, two-thirds of women can't sleep well. What can we do to help them with sleep? Do they need diagnostics? Do they need their iron levels supplemented? Do they need, certainly hormone therapy can be a care solution, but it's one of many. So we have more broadly defined what menopause and perimenopause means for women. And I do think one of the reasons our patients like us so well is that we do bring in this multiple care solutions and options, right? Some women can't or don't want to use hormone therapy, but we have non-hormone
Yeah.
prescriptions. We have supplements. We go through the evidence on lifestyle recommendations that can support it. And really, like we had some patients that would show up and I've been to my naturopath, my OB-GYN, my internist, my cardiologist, and they all told me something slightly different. And they get paralyzed by sometimes conflicting, sometimes not knowing where to start. And I think the fact that we have all those disciplines represented in the Midi care plan, we can sort of help people make common solutions work where possible, and just start engaging in their healthcare.
Yeah. I think what really strikes me the most is the accessibility that's afforded to so many people. I mean, I'm in practice in Manhattan. It's such a tiny little piece
Mhm.
of helping people in on our island, if you will. But the fact that you're national, and I assume just national at this point, tell us about how you manage evidence-based care versus some of the non-guideline type of care, which I am in full on in favor of, but I know that it's controversial in medical circles. Tell us a little about that.
That's a great question. Well, you mentioned a couple things too that were national, and I do think that goes back to your other question too. One of the other reasons MIDI has grown is because we take insurance, right?
Yeah,
So, and we do national contracts, but we also do individual PPO contracts, and we now take PPO contracts for most PPO plans in the nation, which just makes us an accessible care solution, which I do think
yeah,
is really key to the success because we are not designed to meet the 1 and 3 percenters, which we do meet actually, but we are actually designed really as an access solution. So there's one. The question then you're asking about is how do we make decisions on our care plans? And,
yeah,
there's a concept called evidence-informed care. And this means where we don't have full, large scale, huge placebo controlled trials, but we often have huge observational data, right? So, electronic medical records. We see in the country of Denmark that all the women that took hormone therapy, they did not have a higher incidence of breast cancer, right? So, that is not a
right.
placebo controlled prospective trial, but it's a pretty compelling piece of information. So there are layers to this, right? So there's observational data, there's plausible science, and there's also comparing it with what we do know works. So, for example, lowering cholesterol, right? We know statins work. We also know changing diet and nutrition works. People want to try supplements. We do have some science that some supplements actually can lower cholesterol, right? Is it a large scale placebo controlled trial? No. But what we do is our commitment is to share the evidence we know, as well as sort of lean into solutions we know work the best. Um, but
Yeah,
but people are unique, right? They're not they're not wanting like everyone over 50 should try this first. They're going to say, I already tried that, it didn't work, right? So I need to do something. And I also have this other concern. So it's a little bit of bringing back the art of medicine, uh, but being informed by all the evidence. Does that
yeah.
make
I
sense?
love this because I do think clinicians really do get paralyzed sometimes by guidelines and just,
Mhm.
really feeling like they have to stay so rigid. Just a quick patient question. When do patients actually enter your MIDI universe? Is it now getting younger and younger? I'm guessing it's like women in their early 30s at this point.
Well, so if you think about it, as you know, menopause, the average age is 51, but even the
Yeah,
normal range is 45 to 50. But then perimenopause, which has really been where there's a lot evolving, is for most people most of their 40s.
Yeah.
some women back into their 30s, and you think about 6% of women go into early or premature menopause. So we are seeing women younger entering this perimenopause and menopause phase. The other thing we're seeing at Midi, though, is that many of the challenges faced by women because of the hormone change of perimenopause and menopause, they're facing earlier as well, right? So you have, the postpartum period where you have hair loss from, the estrogen depletion that you get after pregnancy and after delivery. You have weight can be a problem for women their whole adult journey. So we support women and women's health really for any adult woman going through any of this, right? So we definitely have a whole suite of options that are relevant for people in perimenopause and menopause, but we've continued to build on our leadership in menopause to meet women's healthcare more broadly. So women are
Mm.
coming to us earlier and later for other health solutions.
Here's today's hot flash. In women, the overall risk of developing cancer increases with age, and this includes breast cancer, uterine cancer, ovarian cancer, and colorectal cancer.
So I'm curious, obviously you can't talk about any aspect of health right now without talking about AI and data. So two questions, but they're related.
Mhm.
Obviously, you have all this data to inform
Mhm.
AI that you use to give more personalized and evidence-based information. How, as a company, are you thinking about using AI, and how do you manage this whole data problem? Now, people in menopause are not necessarily focused on someone knowing they're pregnant or tracking their period, but data in women's health has really become this hot button issue. So first, let's do AI, and then let's do, data privacy.
So we're really excited about using AI. We use it all the time. So certainly there's sort of back office use cases, like we use it for documentation. So your clinician can actually be in the visit with you and not spending their time documenting, right? That was
Hmm.
easy, low-hanging fruit. But what's really exciting, I think, is using AI for decision support, right? So there's just so much information and so much evolving in medicine. We have continuing ed lectures every week that our clinicians go through focused on women's health, right? It's constant new drugs, new therapies, new information, new options. So this is like having a whole brain that stores information for you. So we support our clinicians with continuing ed, obviously, and going through cases so that we all start thinking about it similarly. But we also have it's decision support that's going on in the back end. So when a patient brings up a particular issue or challenge, we can prompt them with sort of reminder that we have this care solution. Here's what the data says, right? And then the experienced clinician is using sort of the art of medicine, but is also being prompted by up-to-date information. So I think the combination of personalized care with the power of AI to find and retrieve relevant information quickly is amazing. And our clinicians love it. So we use the tool, and we design these tools to see what's helpful for them. I mean, I think within an hour they were using these
Yeah.
AI-driven clinical decision support within an hour of it being available.
I'm so curious because, of course, when anything has like a real medical angle, I get super excited. I noticed, so you're the chief medical officer, you have another doctor who is a chief clinical officer, you have a medical director, you have clinical leaders. How many layers are there in terms of this type of care, and what is everybody doing? It seems so interesting.
Well, I wouldn't say they're layers. I think we're all a team. We're
Okay.
now supporting the care being given by 800 clinicians and tens of thousands of
Wow.
patients every week. So there's plenty of opportunity for supporting women giving the care. We really pride ourselves in having the team give consistent care and connected care and best care. So all of those people you mentioned, we staff drop-in rooms, we design continuing ed, we do quality checks and sort of chase down any issues there. So it's sort of a hands-on team approach. Our chief
Yeah.
clinical officer is OB-GYN. I'm internal medicine. So we have slightly different job responsibilities, but we work together all the time.
And do patients experience a continuity of care with the same providers, or do they
Yeah.
bounce around? Great.
So for most things, you'll continue to see the same provider. When you get into things like testosterone or controlled substances, we sometimes will have you just
Yeah.
to make sure the licensure and DEA license match. You may see someone else for that, but most of the time, you're continuity of care. We're beginning to develop subspecialties where we might see you transfer to someone for one specific issue, but you're always going to have a healthcare home and a dedicated provider for you.
Got it.
One of the things that strikes me in terms of access, you mentioned insurance availability, which is critically important. But when you do the numbers, you just referred to how many clinicians you have and how many patients, but based on the most recent numbers, let's say there's roughly 4,000 certified menopause practitioners, which is up significantly from closer to 1,000 10 years
Mhm.
ago. 6,000 women go into menopause every day. There's roughly 8 to 10 million women in menopause overall, and 1.3 to 2 million entering every year. Pick any number you want. Obviously, the ratio of providers to patients is very unbalanced. How are you finding practitioners at the rate you need them to
Yeah.
service this incredibly large and growing number of people who need care, not just menopausal care, but perimenopausal care?
So we find experienced women's health clinicians and find experienced clinicians, but we do actually do our own training and onboarding as well because people have been trained differently and people have had different practices. So
Right.
we bring in our national experts and our most up-to-date expertise. And every single clinician that starts at Midi goes through a training and onboarding with dedicated time and expertise on that.
And is there
So
sort of like a Midi way kind of thing?
we call it Midi University, and you actually have to sort of graduate in order to see your first patient, and that's really how we deliver on consistent care. But things are evolving all the time, so I'm really proud of Midi. We've committed to actually ongoing education because things are evolving. So we have a meeting every week of any women's health updates for the week, and believe me, it is jam packed because there is
I bet.
always something. Yeah, and you know we support. It's actually part of your job. Everyone has that hour off from patient care and sort of must come.
Yeah.
And I
I'm
think
curious if your providers are happier than the average provider out there. And I say that with love and kindness. I don't know if you still see patients. If you don't, do you miss it? And do you think your providers are happy?
so. I had been a clinical executive before here and had stopped seeing patients temporarily and did not like it. So every clinical leader at Midi sees patients. I think it's
Yeah,
really important. I think it helps us
I agree.
understand and be connected. Yeah, so I do see patients and it's my
Great.
favorite part of the week, actually. It also helps us use the tools and make sure we design tools that support the clinicians as well.
Yeah.
I lost sight of your earlier question.
Oh, I was just wondering if the clinicians are happy. Like, for example, in some of these huge, big multi-specialty groups, doctors are afforded what, 10, 15 minutes to deal with the complexities of a perimenopausal or menopausal patient. That's just not right. So they become unhappy and maybe leave and do something else or just burn out. I wondered how you manage that in Midi because you have such a big patient base.
Right. So our commitment as a company is really to listen to where their aches and pains are. So documentation used to take over up
Yeah,
50% of a clinician's time. So if we immediately started using AI to do documentation. So anything that is taking them away from being the clinical expert that they are and using their time for that, we try to actually augment or replace with sort of tech tools that can do it, right? And then let them be clinicians actually executing their expertise. So there's that. I do think the whole telehealth and working from home is interesting as well. It's actually often a a clinician satisfier because,
yeah,
many of the women that specialize in menopause and I say many of the practitioners are women, right, that
Yeah.
specialize. And many women are actually going in midlife as well. So they're
Yeah.
taking care of aging parents. They have kids going off to school. They have grandkids they're helping raise. So it's mobile. So the fact that you can actually work remotely is actually a huge positive given the complexities in our clinicians' lives. So that's a huge satisfier. And then we also understand that they need flexibility. And this actually plays into the needs for patients to have time flexibility. So if you're a Midi clinician and it works for you to start really early in the morning and end early, we can have you work those hours. And that actually works. Another clinician may work late hours. We have clinicians that work in the evening, early morning,
Yeah.
weekend hours, which for patients is an amazing access tool.
Oh,
But
no question.
but it
I have,
matches our clinicians, right? So our
yeah,
clinicians want this variability too, right? And
I have to
Which is
optionality.
laugh.
so interesting because that's not in the early days of your practice, Alyssa, before you entered the world of concierge medicine. Your schedule and making it easy for you, I don't think was on the list of things that people were concerned about.
No, but I have to say, I love what you're saying about it works for the patients. I have literally seen patients for telehealth while they're sitting under their desk, trying to have a doctor visit so nobody knows that they are gone for 10 or 15 minutes. So I
Oh,
appreciate that.
it's really cool. I've had patients do it from a closet in their
In the
office because not everyone
bathroom,
has an
I
office.
know.
They
Yeah.
do it from their parked cars often. They'll go out to their car because that's the only
Yep.
place women get privacy. So, um, I have people do it on breaks from, Amazon factories. I've had people do it. I did have
Amazing.
one woman who wanted to do it from her private jet, which created compliance issues because you cross state lines. But the fact of
Oh,
the matter
wow.
is
That's
women are
probably not a problem you
busy.
encounter every day.
Women are busy, and making getting care easy is so helpful. So you spend a half an hour at a MIDI visit online, right? But if you go to a brick and mortar office, it's half a
Yeah.
day. It's
Yeah.
commuting, parking, waiting, commuting
Even if
back.
you
Yeah.
only spend 10 minutes with a clinician.
Exactly, exactly. So I think our commitment is to make getting care easy because in that way we'll engage more women in care. And I think these decades around 40s and 50s is it's when our cancer risk increases, it's when our cardiovascular risk increases. It's just such an important time for healthcare. You've got to do your screenings. This is the time to lean in to your health because you are going to impact your next decade. So we really work to try and make it easy for them.
I love that as a closer. I do want to ask you one more question for people who are listening who are not yet mini customers. What do you want people to know, whether they wind up enrolling with MIDI or otherwise? What are the couple of questions that women between 40 and however old you want to go? What are the two or three questions they should be asking themselves right now in order to ensure that they have, a longer, healthier life? We all speak about longevity as women live longer, but we're not living healthier. What should women know, and what should they be asking either their MIDI clinician or somebody else?
Well, there's so much. One, I think every woman should have a conversation about if hormone therapy is right for you.
Yeah.
Get that question answered. That should happen in perimenopause, probably, or early menopause, right? Because that's where you're going to have the biggest impact. I think you need to ask yourself, or if you don't know the regulations, I think you need to make sure you're up to date on your cancer screens. Like in your 40s and 50s is when the incidence of cancer goes up, and you need to be up to date on those. I think we also need to be looking at our own daily lifestyle, nutrition, and activity levels, right? So our metabolism changes and we start to lose muscle. So I think it's a time to look at lifestyle things, but also to be screened. Like annual labs should check for traditional lipid things, but also some emerging lipid markers that are linked to
Yeah.
cardiovascular disease. So I think it's a time to lean into health screenings and make sure you're up to date on those. And Midi can help with that. Midi can help with any of those three things, but we designed it because I think these are the three big things that impact women's health, right? I'm not bringing them up because they're what we do. They're what we do because I think they're important.
Right.
Yeah. Of course.
Yeah.
Fantastic.
Well, we have loved watching MIDI just grow like
explode.
crazy.
Yeah.
We've had the chance, as we said, to have Joanna Strober, the founder,
Mhm.
on this podcast before, and it's been amazing over the past several years to watch the growth of the conversation, the growth of Midi and other companies treating women not just as, one moment in time, but as people who deserve to have, prosperous, healthy, highly functioning, full lives as they age and their families grow and their lives get
Yeah.
even more complicated.
Yeah, no, I think it's a female-founded company. We are grateful for the investors that have believed in Joanna's leadership, and the whole team's leadership. And I do think we are actually positively impacting women in general in the workforce because menopause can hit you pretty hard and impacts work as well.
Yeah. Well, it's been our pleasure to have you. We are watching, and thank you so much for all of your wisdom.
Yeah, thanks for all your support.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.